So the 10 paper presentation were over. Welcome back to the session. And well, we actually lost some time for discussion. So I think unfortunately we don't have time to some paper specific questions and answers. So on Hoover and Zoom, some Q&A are already going. So please refer those questions and answers for the paper specific questions. And and meanwhile on Hoover, yeah, we can see some interesting question that can cover all of these papers. So, well, okay, let me start with data availability. So on Zoom, I could see some question, well, specifically to personalized hard state paper, asking if the data set is publicly available. And so is any of you panelist folks, if your data set is publicly available, please let us know. It's a nice opportunity. Anyone? But no data is available publicly.
Hello.
Yes, Nabil.
Hello, Tadashi. Yes, so we're representing NextSense and our wearable neck-worn device and analytics platform. And again, for reasons of rigor, reproducibility, transparency, I think this is a really, really important question. And so we do provide our data publicly, but also we're hoping now to provide also our device design, right, and devices as well to the research community, again, on sort of a request by request basis.
Thank you, Nabil. And meanwhile, well, actually, I'm doing this kind of health-related UbiComp research also. So, I understand how making the data publicly available is difficult. So everybody, all of us understands what the difficulty is. Please share, or could you please share your experience about data set? Well, what's the obstacle for you to open your data? Once your data will be open. Yeah, so Judy?
Yeah, well, I actually put this to our nutrition colleagues because I wanted our data to be publicly available. And after some discussion, we compromised and we aren't making it available. I believe we could have asked the participants. We asked them a million other things. They jumped a lot of hoops. I think we could have asked if they were willing to make it available and maybe only make available what they were willing to make available. But we had to make sure we had socioeconomically diverse participants, and it may be that would have been clobbered by who was willing. But this was multidisciplinary research. Sometimes is quite challenging. The cultures are very different.
Yeah, I understand. And I heard that your research is really a multidisciplinary, cross-disciplinary research. And what kind of, can you share some cultural difference between multiple disciplines?
Oh yeah, they're huge. And what's funny is you often don't realize you have them until you've been misunderstanding each other for many months. But there are established ways that our nutrition people do things. And when we suggested doing them a little differently, maybe we've just failed to, well, they have standard ways, and obviously they've got to publish things the way that they would be expected to, otherwise they wouldn't be accepted in their disciplines. I actually think there's another big challenge, and I think a lot of the results we've got should be of interest for nutrition people. But the work we've published in the nutrition forums has been led by our nutrition colleagues. I think that it's very important to do this and to learn how to do it, but it's also quite challenging.
Yeah, I mean, this first question is actually related to the second question I'd like to ask you all. We got a question on Hoover that, well, many papers have unique populations, obesity, post-stroke, elderly children, and are using ML. So what are the main lessons learned from applying machine learning or UbiComp technology to help those kind of vulnerable populations? I mean, in this session, we have lots of papers related to different aspects of our health, not only the physical health, but the mental health. So each of you panelists are actively working on the UbiComp system. And so what is the main lesson learned from your research?
Well, I don't want to. I can give someone else a chance, but I think that's a really important question, and we do notice, and David Kotz also had a really good question about this as well to our Next Sense project. But really, training on the people we care about, we notice that it introduces heterogeneity and greater variability, and it has potential to really improve our machine learning models. And we do show that training on people, for example, with obesity performs very differently than training on people without obesity in our in these when we test on these different populations. And my students always ask me, why should I study real people? And here are these papers that get sort of this quick turnaround, right? Because they build a quick prototype, use existing sensors, and quickly test it on students because they're readily available. And we truly believe that testing in people we care about doesn't just help or benefit the health field, but also our computing field by sort of introducing new challenges, right? And introducing sort of this increased variability and a realistic data set, if you will. So yeah, those are just my quick thoughts on that.
I'd like to also, I can also add some of my thoughts. So some of, say pathologies or say symptoms or impairments, and everything could be actually very specific to the particular conditions. But for example, I study stroke. Some of the symptoms and impairments are very similar to traumatic brain injury, but it's very different from, for example, other neurological conditions like Parkinson's or Huntington's disease and so on. However, so the trained machine learning can not be directly converted or translated into across different conditions, but in fact, many of these actually share similar type of data to be processed. So rather than directly looking for a way to translate the findings, the process itself, right, could introduce very interesting and novel ideas, how they process the same type of data to extract different types of information. Those entire pipeline could be a very valuable contributions and learning points.
Thank you very much. And yeah, unfortunately, we are running out of time. And okay, I got another question from Gregory on Zoom, I think. So Gregory said, I want the panelists to discuss the importance of publishing this technology work outside the technology forums. He said, successful application of UbiComp technologies need to disappear from the UbiComp and impact other fields, just like the UbiComp vision is something like the technology will be disappearing to the field. So what do you think? How do you think about interdisciplinary publication or going to medical field some other important field outside UbiComp field?
So,
How do you feel?
I can like take that question.
Varun.
In our project, in the State of Separately project, we had collaborators who were psychologists, and there's a clear demarcation, at least now, that we as computer scientists, we would be focusing on the technical aspects of it, like how we are delivering the intervention, whereas the psychologists and behavioral scientists are involved in what the content of the intervention is, or if the intervention is effective or not. So there is this very clear demarcation that we had in our project, and that I have seen in several other projects as well, because the technical part of it and how the system works is presented in conferences like UbiComp or Kai, whereas the behavioral science behind it is published in psychology venues or medical venues. And one reason is that because the expectations from those communities are different. So it's kind of hard from our perspective as technologists or computer scientists to break into those venues, and as lead authors, that is, to break into those venues and match those expectations of those communities. So that is one barrier that I have seen.
Okay, thanks, Varun. So you have your venue, Kai or UbiComp, and your collaborator has their own venue to publish right now, right?
Yeah.
Yeah, but yeah. So our next challenge would be even beyond that. Yeah, hopefully that will be a next level challenge for UbiComp. So, well, unfortunately, we are almost running out of time. So, well, everybody, thanks for your presentation and active discussion.